65-year-old man present with complaints of weakness in swollen gums for past 3 weeks. He also says he cut his finger while cooking and bleeding took more than 10 minutes to stop. He has a family history of diabetes mellitus, type 2, and prostate cancer. Current medications are multivitamin. Blood pressure is 122 by 67. Respiration is normal. Temperature is normal. He is pale and lethargic. Cardiac examination shows a pulmonary wall flow murmur. There is significant hepatosplenomegaly, oral mucosa petechiae, and gum hypertrophy is present. Blood smear reveals myeloperoxidase positive cells and or rods. Bone marrow biopsy shows more than 30% blast cells, which are the following chromosomal abnormality is associated with patient's most likely diagnosis. JAK2 mutation, translocation between 922, translocation between 1517, translocation 1114, or translocation 814. The diagnosis over here is AML, uh, and they're asking which gene is involved. So there is 1517 translocation. 1517 translocation occurs. Treatment of this condition is giving vitamin A. So I think the diagnosis for this question is clear. They have actually given away once myeloperoxidase positive cells and with or rods. If this is mentioned, it is very clear that this patient is suffering from AML, acute myelogenous leukemia. Basically, more specifically, acute promyelocytic leukemia, APML, and in APML there is 1517 translocation.
Thanks for watching. Please give a thumbs up and subscribe for more.